Today we have with us none other than Dr. Muhammed Rafeeque in conversation. And Dr. Rafeeque requires no introduction, yet I would like to introduce him. He's a medical officer in the Department of Homeopathy, Government of Kerala. He has authored many books, especially books on Materia Medica. He has authored Master of Materia Medica, Rapid Prescribing, Drug Addiction and its Side Effects, a Homeopathic Approach, and a Capsule of Materia Medica. And he has presented numerous articles and papers in various conferences and journals. So, Dr. Rafeeque, a very warm welcome.
Thank you, Dr. Bhatia.
I'm very excited to have you as one of the speakers in our Master Homeopathy Academy course on case taking. So this conversation will be about your approach to case taking.
Yeah.
Now, the one question that comes to my mind is that you are primarily an author of Materia Medica, and you have written a book on rapid prescribing.
Yeah.
And you also are a practitioner in a government department, a medical officer. I know in Kerala, homeopathy is very popular, and sometimes we have large number of patients to be seen in a very short period of time as a medical officer in a government hospital. How do you take a case that assists you in rapid prescribing in a government OPD setup?
Yeah. Taking a case in a government OPD when we have number of patients, many times when I started my career, it was very difficult for me because the way we have studied in the colleges how to take the case, it's naturally a process that takes more time. We need to listen. You can just only ask, okay, what else? So it was very difficult for me because I have to finish the patients, the number of patients may be more. So it's not possible to wait for half an hour and complete one case. It's not possible in government setup. So what I have done is, as every medical officer, I started searching for the way we get the case in real sense in terms of homeopathy. It is not just blindly prescribing, because blind prescription may give some result, initial result, but the follow-up, the most difficult prescription, that is second prescription, may not be easy, and the result may not be good. And the result, what we get, the so-called result, may not persist, and complications may come across. So when the patient comes, as every homeopath, I listen and often get some keywords. And the most important thing is concomitants. For example, if a patient comes with headache, and he will say that, doctor, I have headache, severe pain I have. And he may give some valuable concomitant. That's very important. And the way he presents the case, the facial expression, hand gestures, everything will tell. For example, if there is dullness, dizziness, drowsiness, it will be expressed through the face. So when we listen to a patient, we must look at his face, his hand gestures, facial expression. That will give some clue. So if there is dullness, dizziness, immediately we may think, of course, it is a wrong way. When a patient gives a symptom, we should not think about a remedy. But we can just keep an idea, okay, he is going towards this remedy or that remedy, or he is going away from that remedy. And let him talk for a few more minutes, and we can confirm the remedy. And sometimes the bystander, we can interact with them. So case taking is not just only interacting with the patient, or sometimes even just by looking at the case paper, we may get some hint. Maybe it's a miasmatic expression of that patient, or maybe the pathology. So using that, we can connect with the investigation report, with the symptoms of the patient, his behavior, his nature, and most important thing is family history. Many times when we take the case, patient may keep on talking about his day-to-day matters, affairs, and all, stress and all factors. Many times we may ignore the family history. Commonly when we ask a patient, do you have any history of in your family forefathers or having any special disease or anything? They may say, okay, all are healthy, and just ask about how is your father? Father is no more. What happened? He had cancer of the throat. And how about mother? Mother is no more. She had tuberculosis. And most of such patients, they don't tell when we ask, is there any history of any illness, significant illness in your family? They may say, no, everything normal, normal, normal. So direct question we have to ask, what happened to your father? What was his disease? Then we get the clear. So what Hahnemann has said, give more importance to family history. Many times we may ignore. And the words used by the patient, some words, even though they have no idea about homeopathy, they may give the exact indication given in our Materia Medica or even a rubric. It happens many times. They may be illiterate. So even from an illiterate patient, we may get exact words mentioned in our Materia Medica and repertory books. And words from the mother, that's also very important. Many times when the mother comes, she will give the indications. The child is having diarrhea since 2 days, passing frequent stools, but child is happy, moving around. Very simple, easy to select acid force for such case. So another mother says that, doctor, my son is very sick since yesterday, and day before yesterday he was very active, full of energy. And doctor, believe me, my son, when he gets a disease, just before that he becomes very active, very appetite more, activity more, happy. Then I feel little tense because he's going to suffer. That's a clear indication of sorinum. So when we get such indications, these are very valid. Just look for the generals or any contraindications we can prescribe. So look at the patient. We can easily identify the remedy most of the time, of course, not always. And even constitutional remedy, it may take time, a third or fourth or fifth sitting, that depends. But the presenting complaints must be targeted. For example, if a person having so many health issues and comes with abdominal pain and holding the belly and bent forward, doctor, I have pain. You can think of, and feeling better when I do like this, you can think of colocin. We should never torture the patient by asking so many questions, history and all. First, manage that acute crisis with the indicated remedy. And once he is free, let him come next time, and then we may get the take. So don't, we should never prescribe for the acute picture and the chronic picture together. That may spoil the case. So if you observe, within a few minutes, we get the case and we can start the case. Thank you. Prescription.
Yes, that's true. Even Hahnemann has written that in an acute state, in an acute aggravation of a chronic state, or in an acute state itself, you have to prescribe a separate remedy depending upon the acute totality. Yeah. What other pitfalls are there that one should be watchful for? What other mistakes young students can make when prescribing rapidly, especially regarding case taking?
Of course, as our pioneers said, leading question. For example, we often see that when a headache case comes, students immediately, even not students, we all do that mistake. Do you like salt? And we know that it is to prescribe natrum muriaticum. So that kind of direct question should never be asked. And that is first thing. And second thing is, when the patient moves away from the topic, do not obstruct, because he may go out of topic somewhere, but he will take us to that remedy. That should not. So, and another thing is that while taking the case, especially beginners, our target may be towards only the pathology and disease diagnosis. So we should let the patient talk his pains, sufferings, more than the disease diagnosis. Of course, we must diagnose all diseases, but we should try to differentiate one patient from another patient having the same disease. That's what homeopathy is for. So freedom must be given, and creating rapport with the patient, that we don't do many times. If we have good rapport with the patient, he will tell everything, all issues, the stress, even the things he never tell others, but he will communicate with the homeopath. So we must make a situation favorable for a case taking. So creating rapport, enough privacy is needed. Many dispensaries or clinics don't have enough privacy, so patients feel uncomfortable to tell. So, and a good friendship, a good relationship, that's very important. And even we can talk in a local language. That's very important. Homeopaths must speak local language. Even the slang used by the patient, that can be used while communicating. So, and even the posture of a homeopath. And when they express their pain, stress, we must support them. That's very, it's not just acting. It's from the heart, it should come. So when you smile, when the moment when the patient comes to our consultation, we should smile, look at them, welcome them. It's not just acting. The smile should come from the heart, not from the zygomaticus major and minor. That's it.
Good. So, Dr. Rafeeque, you are one of the master teachers in the upcoming course on mastering case taking with the masters. What is it that you are going to teach our students in the academy?
Of course, it's about case taking, since the theme is case taking. I may not be teaching a new approach, but whatever our pioneers have taught me and my teachers and my experience, and more from my failures. I may talk more about my failures, because we learn more from the failures. Because when during seminars, we share only the cured cases, but we hardly mention about the failed cases. So from the failures, we have to learn, because each failure is a great message. So how to take the case, and how not to, and what is the way we must, we should avoid the things that will be shared, and different approaches, and some of the blind prescription also I will mention, because I have experienced that for those cases, I took hours or several attempts. I took the case in detail, but patient was not responding. And finally, a blind prescription gave me the result. In fact, it is not blind, because I had looked at that crucial point, consider that, and it was selected. It was a short prescription, but gave result. So everything. My talk will be almost a miscellaneous topic. Means I've compiled from all my PowerPoints, and then will make accordingly as per the subject. That's what I am planning for, rather than just talking only on case taking and its different approaches. But I will be talking everything about that.
We all look forward to learning from your experience. So, thank you so much, Dr. Rafeeque, for giving us insight into what you are going to teach. And to everybody who is listening to our conversation today, if you have not registered as yet for the Mastering the Case Taking course with the Masters, I urge all of you to go ahead at the Academy site, academy.drbhatia.com, and register for this wonderful upcoming course where we have Dr. Rafeeque also as one of the main teachers. So thank you, Dr. Rafeeque, so much.